Last week, we met Dr. Cleopatra Patterson, a doctor guiding children through complex heart surgery. This week, we explore what it costs to do that kind of work, the choices, the compromises, and the reality of caring for other people's children while raising your own. I'm Archibald Gordon. This is Profile. Welcome to Profile. Today is part 2 of my conversation with Dr. Cleopatra Patterson, who is going to be completing her title for me, and you'll find out why. She's a pediatric cardiac anesthetist
and intensivist
at Boston Hospital for Children. This is going to be her work for this week because that word is so difficult for me, anesthetist. And this is a doctor that's taking care of children putting them under, dealing with consciousness, but also dealing with children in the intensive care unit at Boston Hospital for Children at one of the most vulnerable parts of life. And I want to delve into just the difficulty of dealing with children in and of itself. Because when you're dealing with an adult, there's a level of, is there more of a level of predictability with the adults, or,
Well, when you are trained, you take care of the predictability part. Mm-hmm. To be fair, you're dealing with human beings and whatever is going on with a disease process. Mm-hmm. Unfortunately, there's training for that. So whether it's an adult or a child or a small baby, a big baby, there's training for that. The hardest part of our job is the emotional component. If we are talking about a child who has nothing to do most of the time with why they are ill.
Yes.
Illness, doesn't discriminate. It just happens or doesn't happen. We have parents to deal with and caregivers. They may be a part of the disease process as well, or maybe the situation that the child has been living in has something to do with the reason why they are presenting in front of us. So that is the part that gets hard, because you have to distance yourself as the professional and focus on the disease process and the organ system. Try to make sure that is your priority, and then now look at the psychosocial things that are going on to make sure you do not put the child back into a situation that brings them back to you again.
So when you find yourself in this sort of scenario, this attracts you more? Because last week when you ended, you were talking about the fact that, you're at work.
Yeah. I love complexity. I love complexity. Add on the layers, I'm here for it. I like complex disease and I love complex treatment. And the more things that are going on, the happier I'm probably getting.
Really?
Yes, I really love complex work.
And children are, you were telling me earlier, are some of the most complicated, because just in the age of being young children to adolescents, mm-hmm. they are each different. They're different.
They're all different, and they are not little adults. They're not little adults. And sometimes that is the part I enjoy the most, but that's the hardest part, to communicate to others. Let us look at a premature newborn. Mm-hmm. A baby that comes out too early, the skin is not well developed. So the way they lose water, they dehydrate so much faster. Oh. So there are so many things we have to have in place for that. That little brain is not fully grown, so we have to be careful about that and manage their sugars. Their liver doesn't have enough reserve that if you don't feed them, that they can produce enough glucose to keep their bodies going. They can't even keep their little selves warm. So when you go to a place that has premature babies, they are in warmers, they are in plastic boxes that, and then just weeks after that, that baby can be in a cot, they can be at home chilling with you on your veranda and lying with their mamas.
Does that make it harder to deal with the baby, or the adults are also as complex as we develop?
So, all right, there's bias. Babies are cute, right? And they are smaller. They tend not to fight. You don't have to really contend with certain components of adult care, like resistance and so on. The small...
Doctor, I'll take my medicine, but I don't take... I don't actually take my medicine, or me not take the medicine.
And or they come and say, I've done the research, and this is what they are going to do. So a small baby appeals to another part of your brain. So it's not about more complex or less complex. Yes. It's just who is the patient and what are the needs for them. I like meeting the pediatric patient where they are. I love that. But I love adults too, but not as much. And I love the elderly. So I love the extremes of age. I am happiest caring for because the layers of complexity appeal to me. But the standard adult can be complex too, but it's usually some psychological thing that takes a lot more mental work.
All right, so the complexity is what attracts you to the job.
Yes.
As you continue to develop in Bustamante Hospital, your complexity within a system that has its own complexity, by the way. So I don't need to tell anybody about the shortages that we have in our public health sector and all of the difficulties that we have. I imagine as you're doing more specialist care, it is even more difficult.
Yeah, this is true. But one of the things that we do have are really good people. We have such committed healthcare professionals. I mean, I can only speak from my own experience, but at the Bustamante Hospital for Children, I am a part of a phenomenal team of people who are dedicated to making children well. I won't be able to say why it happens there. I think Bustamante is a choice for men. So if you're there, you have chosen to be there. Mm-hmm. It's not somewhere where you must go, I think is what I'm trying to communicate. So I think because of that, we ended up with people who are dedicated to this type of work. So when you come there are so many people who just want children to be well in every category of healthcare provider. So that helps to counter some of the low resources, things that cost money, that we don't have. We have people who are going to stretch themselves. Requires a bit of creativity because we don't always have everything we want, but we are able to provide good quality care to our patients.
So in that sense, I wonder from that kind of perspective, what are some of the biggest challenges and how you deal with them? But we have to take our first break on part 2 of my conversation with Dr. Cleopatra Patterson, and we're back with you after these messages.